of Magellan Healthcare. I'm here today to talk to you about what is Medicare and help educate you on the decisions that need to be made. Medicare is the largest health insurance provider in the nation. It is backed by the federal government, and oftentimes people are eligible when they're turning 65, when they have a serious health condition, or if they've been disabled and are eligible after often 2 years. So how do I become eligible? There's a few things that you have to do. First off, you have to live within the US, and typically you want to have worked for 10 years or 40 tax quarters to be eligible at a reduced cost. So if I know that I'm eligible, how do I enroll? It's super simple. You have 3 options. You can go online to the Medicare website at ssa.gov and do your enrollment there. Or you can do the old-fashioned paperwork and have it sent in. And finally, if you have an agency office that is open in your area, you can schedule an appointment to try to go in. We always suggest that you try to go online first because it is the most friendly and quickest way to get enrolled to be able to make your options. Okay, so when do I enroll? Traditionally, unless you have some kind of qualifying reason, you're going to look at enrolling 3 months prior to your 65th birthday. What you can do is you can start looking at those options and figure out, what do I want to do? Am I going to retire? Am I going to continue to work? All the questions that you'll want to get answers to in order to decide your Medicare path. So when I finally do enroll, what exactly am I enrolling in? Let's break down the parts of Medicare. First and foremost, in the 4 parts of Medicare, we have Original Medicare, Parts A and B. Part A of Medicare, it covers your hospitalizations. That is going to be anything that is inpatient. So if you have to go in for a surgery and you are in the hospital, your Part A will cover that. In addition, it does cover some home health care, hospice, and rehabilitation centers. So Part A of Medicare is traditionally free to most Americans. Now, what do I mean by that? What I mean is, oftentimes you have paid for Part A through working. If you've paid for 10 years or 40 tax quarters into the Medicare taxes, you will have already prepaid for that Part A coverage. If you don't, because maybe you're a stay-at-home provider or you worked from home and didn't pay into that tax, you could potentially qualify through your spouse's credits. If you don't, no worries. You will just have to look at what it will cost you to have Part A monthly through the breakdowns available on the Medicare website. The second part of Original Medicare is Part B, and that is for your doctor's coverage. Doctor's coverage is anything that happens on a day-to-day basis, such as going to see your primary care physician in case you have a cold, the flu, or potentially you mess up your ankle when playing basketball with the kiddos. What you do with Part B is you will have a deductible, and then you will have a split cost of 80% covered by Original Medicare and 20% covered by you. There's no cap to the cost of Original Medicare on Part B, so it is important to know that you have to figure out how to fill the gaps. That's where Part C and Part D of Medicare come into place. Part C is also known as Medicare Advantage. We also have that referred to as MA or MAPD plans. These plans are partnered with Original Medicare, and they take the assignment of the responsibility for your payment. Private healthcare providers offer these plans to you in network opportunities. So you can decide what network you want to be in and what doctors or hospitals are important for you to see. Many people like Part C because it has low to no premium, and it will have built-in benefits such as dental, vision, and hearing preventative measures, as well as gym memberships and other perks. So if that doesn't sound like necessarily what you would like to do, then we can look at Part D, Original Prescription Drug Coverage. This standalone coverage is often partnered with a Medicare supplement plan, also known as a Medigap. Prescription drug coverage is there for you for exactly what it says: your maintenance medications and any prescription medications that your doctor may need to prescribe to you along the way. When paired with a Medicare supplement, those supplements fill the gap and help to cover anything that Original Medicare would not cover for. For Medicare supplements, those who turn 65 after January 1st of 2020 have a default policy available to them called Plan G. In most states, this plan is going to give you the most robust coverage, and you will be responsible for your Part B deductible annually, and then your coverage will often pick up the places where Medicare is expecting you to pay. I know we've gone through a lot today, and there's a lot more questions that you may still have. That's why our team and agents are here to help. Give us a call or visit us at our website so we can help you with your individual Medicare journey.